There is a lot of public anxiety about HMPV or Human Metapneumovirus. Just because the name of the virus is long and impressive, that doesn't mean the virus is severe or serious. This is a common cold virus that has affected most children around the world already for decades. It has been around. It is just that when we get a common cold as a child, doctors are not going to test what virus it is due to because it's a self-limiting illness. The condition goes away on its own. So outside of research settings, these tests are not done. The visuals that are apparently from China show crowded hospitals with people wearing masks and holding IV drips. But these are common occurrences every winter season in China, and there is no indication that this season is any different. But the narratives that have been inserted along with these visuals are quite compelling, and in fact they fool many people into thinking there is something really wrong that is happening in China. People are mainly afraid because the COVID-19 pandemic had similar origins when cases were first reported in China and they reached all around the world. So this discovery of HMPV in India has nothing to do with a new virus. It is just that when the hospital checked what viruses are affecting the child, they found human metapneumovirus, as they always did all around the world. So in other words, this is not a new virus, this is not a virus to be afraid of, and this is not COVID, and it is not going to be a pandemic. This is an example of how much public anxiety can be caused by such forwards. The HMPV is one of several viruses that cause common colds in children. In fact, if we take children aged 3 or 4, almost all of them would have had at least one bout of HMPV infection. While it's true that in very few instances it can turn severe, that's the case with almost all pathogens that are known to man, viruses and bacteria included. There's no indication that a mutation would have occurred with this virus because there's been no change in its behavior, its clinical pattern or mode of spread. An important lesson is do not trust everything we see and read on social media, especially random forwards from foreign countries with scary narratives.